Apart from aminoglycosides, tetracyclines, chloramphenicol, etc., there are also other protein synthesis inhibitors. There are clindamycin, streptogramins, linezolide, spectinomycin, fusdic acid, and mupiracin. Coming first to clindamycin, it is not a macrolide, but its mechanism of action and resistance patterns are the same as those for macrolides. It has a narrow spectrum of activity and can be used against gram-positive cocci such as MRSA and also against anaerobes such as Bacteroides fragilis as a backup drug. Now, one thing that you need to remember about clindamycin is that it is not active against gram-negative bacteria. So, one use of clindamycin, that is osteomyelitis, because it reaches high concentration in the bone, unlike tetracyclines which also get deposited in the bone but do not retain their antimicrobial properties. Clindamycin can be used only in the osteomyelitis caused by gram-positive bacteria such as Staph aureus, and not the osteomyelitis that is associated with gram-negative bacteria such as Pseudomonas and Salmonella, etc. A major side effect associated with clindamycin use is pseudomembranous colitis, and it is the most likely cause of this side effect, clindamycin. The drug of choice to treat this condition is metronidazole, while vancomycin is just used as a reserve drug. Overall, clindamycin is a bacteriostatic drug. Coming to streptogramins that include quinupristin and dalfopristin, they are used together because they have a synergistic action. Their mechanism of action is such that they bind to the 50S ribosomal subunit and inhibit protein synthesis by preventing transfer RNA binding to the acceptor site and also decreasing the release of the completed polypeptide by blocking its extrusion. Streptogramins are bactericidal for streptococci and staphylococci, while they are bacteriostatic for Enterococcus faecium. Their spectrum of activity include gram-positive cocci including MRSA, VRSA, and VRE, that is vancomycin resistant Enterococcus faecium, not faecalis. For activity against faecalis, we need linezolide, that is the next antibiotic. How linezolide acts is by inhibiting the initiation complex formation and thus is a bacteriostatic drug. It is bactericidal for Streptococcus only. It has mainly activity is against gram-positive organisms, as we can see, that is against MRSA, VRSA, VRE, Listeria, and all of these organisms, when cause skin and soft tissues infections, then we can use linezolide. It can have GI side effects and bone marrow suppression as well, leading to anemia, leukopenia, and pancytopenia, etc. Coming to spectinomycin, its activity is by binding to the 30S subunit of the ribosomes and acts as a bacteriostatic drug. Its activity is only against gram-negative bacteria, that is its activity against gonococcal infections, and also the ones which are multi-drug resistance, and it can be used in patients who are allergic to penicillins. The mode of administration is IM and only one shot is given. The side effects can include pain and rashes at the site of injection and also fever. Lastly, fusdic acid and mupirocin both can be used topically for skin infections such as boils, folliculitis, impetigo, burns, open wounds, and ulcers, etc. And we know Staph aureus and strep pyogenes are the main culprits behind these. So both of these can be used against gram-positive bacteria, that is Staph aureus, and mupirocin can be used against MRSA and also against strep pyogenes. They're also both of them are bacteriostatic.